Today, I'm pleased to announce that I will be signing an executive order to reschedule marijuana from a Schedule I to a Schedule III controlled substance with legitimate medical uses. We have people begging for me to do this, people that are in great pain. For decades, this action has been requested by American patients suffering from extreme pain, incurable diseases, aggressive cancers, seizure disorders, neurological problems, and more, including numerous veterans with service-related injuries and older Americans who live with chronic medical problems that severely degrade their quality of life. I want to emphasize that the order is not the legalization, or it doesn't legalize marijuana in any way, shape, or form, and in no way sanctions its use as a recreational drug. It has nothing to do with that. At the same time, the facts compel the federal government to recognize that marijuana can be legitimate in terms of medical applications when carefully administered. In some cases, this may include the use as a substitute for addictive and potentially lethal opioid painkillers, and they cause tremendous problems. This can do it in a much lesser way, can make people feel much better that are living through tremendous pain and problems. 40 states and multiple U.S. territories have already recognized the use of medical marijuana. This reclassification order will make it far easier to conduct marijuana-related medical research, allowing us to study benefits, potential dangers, and future treatments. It's going to have a tremendously positive impact, I believe. We're also asking Congress to reconsider its classification of hemp-derived CBD to ensure seniors can access CBD products they have found beneficial for pain and other reasons. Some people are literally dying, and they're dying with tremendous pain, and this can, in many cases, literally stop it. And they have their senses about them, as opposed to painkillers, which don't allow that, don't allow them to die with dignity, frankly.
Really difficult to do high-quality randomized controlled trials of a substance that's federally illegal. This rescheduling has the potential to change all of that and to rewrite the way that we do research related to cannabis in the United States in three ways. First of all, it'll democratize the research process so that all academic institutions can participate in research, not just elite academic medical centers. Number two, it'll give patients and researchers access to highly refined, reliable sources of cannabis rather than relying on one or two sources around the country. And last but not least, it'll let us do the sorts of large-scale randomized controlled trials that we do in oncology and cardiology. Not dozens of patients, but hundreds or thousands of patients. That's how we learn, that's how we produce valuable knowledge that's useful in guiding treatment decisions.
And research is crucial in order for us to, for example, understand what may be and for whom the dangers of cannabis. Yes, cannabis can be addictive, and certainly people, adolescents and children may be the most vulnerable. But we cannot close our eyes to research and the opportunity that we are hearing from patients that for some of them, cannabis can solve their problem.
There are valid claims about the negative impacts, about addiction, about psychosis, about adverse public health impacts, and impacts particularly on young people. So we haven't been, the evidence on all of these is anecdotal and it's hypothetical because we have not been able to do scientific studies. There is no standardized dosing. And if you don't have standardized dosing, any study that you do is comparing apples to pears. And we don't know the difference between botanicals and synthetics, and all of these questions we're now going to be able to answer. 5 administrations have promised to act on this issue. The Biden administration promised to do this, and the proposal began during the Biden administration. It got mired down in the chaos and inertia and disorganization of that. And I want to thank President Trump, who made the promise during the 2024 election that he was going to come in and solve this issue, that he was going to take decisive action, and he has kept that promise today.